Selina, hi, and thank you so much for joining me here on Faces of Digital Health to talk about a very important topic that still might make some people blush. That's sexual health. On the broader level, sexual health can include everything from reproductive health, sexual transmitted infections prevention and treatment, sexual pleasure, gender identity, relationships. In women, we usually associate it with reproductive health, contraception, maternal health, or to menopause. But then in men, there's various aspects from erectile dysfunction, again, fertility, hormone health, prostate health. It's a really, really broad area. And you, as someone who's the expert in the field, can we start by just explaining your focus area inside this broad thematic field, and we'll go from there.
Yes, very happy to be here. Thanks for having me. And I'm especially happy to give women's sexual health a special attention because it's very much needed. It's very prevalent, but at the same time, as you already said, very underserved. So it's great to talk about it today. So my background is that I'm a clinical psychologist and I have a postgraduate training in sex therapy. And my personal experience comes from especially research, but also clinical experience with women that experience problems in sexual functioning, meaning it could be that they have problems with sexual desire, arousal, orgasm, or also sexual pain conditions. And usually we treat these women either way by themselves or also with their partner if they are willing to have their partner there as well. And when we talk about my personal research, we also have a focus on women's sexual health. And my PhD basically focusing on the one side, first of all, understand how is the current landscape when it comes to help-seeking behavior and healthcare needs in Germany. So what we did was actually a representative survey with 4,000 people included in Germany to ask about these questions. And from that, basically draw the knowledge to also develop a digital intervention that fits the needs of women with sexual distress in conjunction with the sexual dysfunction. And yeah, this is what I'm currently doing and what I'm excited to talk about.
Awesome. We're gonna pack all of that. So where we are in terms of understanding sexual distress. Yes. But just before we go there, I want to understand a little bit better the current public perception and the knowledge that we have about sexual health. So, for example, in recent years, topics about women's health and female bodies have become slightly less taboo. There are several apps that are supporting the understanding and the exploration of pleasure. There's Meet Rosie, which is one of the successful US startups. There's several new books that, such as Come As You Are, which is basically exploring the physiology and understanding of different physiological signs and what they mean for women. Obviously also useful for men to understand female bodies. So to a degree, it seems that we are learning a little bit more and discussing these topics a bit more. What are you observing since you started this research, since you started studying this? What kind of changes on the societal level towards this?
Yes, you're absolutely right. A lot of things are happening, which is great, but unfortunately still there's so much more to be done. We do notice that, of course, regarding the lack of education that we're having or that we have experienced also in past generations, that this, of course, gets better, especially also with social media. But of course, also with that, other maybe problems arise because sexuality is portrayed in a very certain way, maybe. And it's always good to talk about it from a very early age on in a supportive way. We know that this is a good thing. And when we now look at how sexual dysfunction in conjunction with sexual distress develop, we do know that one of the etiological factors that can lead to a sexual dysfunction with sexual distress, maybe I explain in a second what now I mean by this term in medical terms, but one of the etiological factors is actually the lack of education, next to other factors like medical issues, surgery, mental health issues, or also problems around relationship or cultural aspects that all can influence the development of a sexual dysfunction. So educational aspects are very good, that they are more, that we know more about, or that we can talk more openly about sexuality in a way. But it really is the question about what we talk more openly. In recent years, we talk more about the pleasure aspect and how it can be better, to be better in bed. But what we still do not talk so much about is the negative side of it, the distress component, because this is still around a lot of shame and stigma. And this is also what we realize when patients did come in, that even though we might think there's a lot of education still out, that there's still a lot of more needed. And also, this is exactly then why we are started also on building this digital intervention, because an insight from the representative survey actually was that we asked the women about what they would want for developments in the healthcare system. And one of the most named aspects was better information offerings. So even though we see all of that, we still notice that there's a need for better information offerings.
Mm-hmm. Yeah. So let's define sexual distress. I read the book Come As You Are, the revised and updated New Science by Emily Nagoski. And what I thought was kind of empowering, I guess, was the emphasis that everyone is different. So there's no right or wrong way in terms of how you experience pleasure, how long it takes you to, get there. Yes. So what is defined as sexual distress in medical terms?
Yes, absolutely. Very happy to do that. So when we talk about sexual distress, what we mean is the subjective appraisal or suffering that you have related to your sexual functioning. And the sexual function includes, as I already said in the beginning, desire, arousal, orgasm, or also pain during sex. And when we look at ICD, like international classification criteria, the latest version 11, or also the previous one that is very well used still in practice, is that it is defined as having a sexual impairment in one of these domains, and then plus the subjective distress. And this distress is the relevant criterion to receive the diagnosis in the medical system. And this is also what makes it then treatable, or that it needs the certain attention in the healthcare system. So it's really about the personal appraisal of a person, if it is a problem or not. So this also means that for some people, maybe they have a lack of desire compared to a few years ago. But if they don't experience subjective distress about it because it's a problem in their partnership, or they feel stressed about it, or are afraid of what impact it has on the relationship in the long term, then they would not fulfill the criteria of the sexual dysfunction in the medical terms. But if you feel distressed, then you need the attention and you need treatment, basically.
Mm-hmm. Before we go to treatment, I'm still very curious to learn more about how this is diagnosed, especially since this is a very sensitive topic that can be related to shame. Do patients usually, for example, come to you? How do you see that doctors ask patients about this issue, and how can they be sure that they don't just ask for the sake of asking and get an automatic response that everything is fine, because people don't really want to share that they're struggling?
Yeah, maybe I answer that in two ways. First, that I say how it should be assessed, or what would be good, and then also maybe give you some insights on what is currently happening in the healthcare system and how women also are willing to talk about it, but what are the issues maybe around that. So how to assess it is basically there are basically the two main ways are first, of course, in a clinical assessment. So the healthcare provider can just ask the person in a way, explain maybe first a little bit that sexuality is an integral part of human life and well-being, also defined as by the World Health Organization, and that this is the reason why you want to ask certain questions around that domain. And then you basically ask if there are any recent problems in these domains of desire, arousal, orgasm, or pain, and how that made them feel, if they feel distressed about it. And you would also ask like how long the problem persists, to understand if it's like a lifelong problem or a quiet problem. And what you would also want to know is when it occurs. Does it just happen in partnered situations, or is it generalized, not just in certain situations, but is it like regardless of the partner or the situation it happens? So also in masturbation you maybe have the problem, and this gives you the insights to get the diagnosis right as a healthcare provider. And the other way, of course, we also do have validated questionnaires. There are a few that internationally are used and also recommended by international sexual medicine societies. One is the female sexual distress scale. It's like the latest version has 15 items. And we also, as a research group, are currently validating this instrument in German, so that we also in German language have more accessible, easy tools to assess it. Because what we do know, both from data and also from experience and what patients tell us, is that right now it's still very, very difficult to talk with healthcare providers about the topic of sexual health. And this has a few issues, and I'm happy to talk about that if I should.
Yeah, absolutely. So I think we now explained very well what sexual distress is. So we go ahead by sharing more about what are the current therapeutic approaches and barriers in healthcare.
Yes. So right now, and this is like also this insight's now drawn from this representative survey on help-seeking behavior. We do know that most of the women, when they notice something is wrong, they, of course, we're in 2025, they go to the internet, they Google it, and they try to find trustworthy information and sources. But what they usually tell us is that they are completely overwhelmed by all of the informations they find, and they also do not really know which of the information is now the trustworthy source. So the first professional contact provider is the gynecologist. And with gynecologists, we have the issue that, of course, they are very busy. They see a lot of patients, and the time they have that is reimbursed with a patient is very short, just a couple of minutes. And talking about sexuality costs a little bit of time, because as you said, maybe there's shame included also for the person itself, to like come to the topic and be like ready to say like, listen, I have a problem in XYZ. And further, the issue with gynecologists is unfortunately that they don't have a proper training in sexual health unless they haven't done like a postgraduate training to become a sexual medicine expert. So women usually go there, and what we also do know, if the problem occurs for a longer period, they usually go there very open and be like, hey, listen, I have that and that, after a few times going to the gynecologist. But unfortunately, it doesn't really get properly treated because of the time, not really assessing it, and then also not really knowing for them where to really refer to get it fixed. And then usually what we do know is that after they experience that they have gone to many gynecologists, tried out a lot of things. Of course, this does also something to your mental health. And so what we often see is that these women then seek psychotherapy because this is also reimbursed, and they then have time to talk about the distress component. But again, unfortunately, there they talk very well about distress, anxiety, depressive symptoms, all of that. But again, psychotherapists also do not have usually a specialized training in sex therapy. So again, and there's very well proper data basically that also shows that healthcare providers themselves have shame of addressing the topic, especially if they're not properly trained and don't know how to ask, and rather than not talk about it.
Yeah, that's a great point. In one of the previous episodes, I had a discussion with a French gynecologist, Jerome Boisis, who basically created a whole company and an AI system to give patients 100 questions even before they come to the doctor's office. So you can go through some of those questions alone, and there's no discomfort with the doctor and the patients either asking or answering the questions. So that's a huge part of actually detecting and then treating this. And I guess that patients also worry what's going to land in their record, especially now that everything's getting digitized. Speaking of digitalization, what role does digital play in sexual health? Can you outline the research and the market a little bit?
Yes, very happy to do so. So when we were seeing this, maybe I say something, because when we were seeing we have the huge need of a lot of women being impacted by sexual dysfunction. I think I didn't mention how many they are. We know that the lifetime prevalence actually for experiencing a sexual problem and not with distress or without, but having a problem at any point in your life, is it for women above 70%, for men is around 55%. And when we talk about the problem in conjunction with the distress, it's 25% in women and around 20% in men. So 1 in 4 women has the problem. And right now they are silently suffering, because from the representative survey data, we also do know that right now most of them do not get proper treatment. Really the majority does not get proper treatment. And so the question is also, what would be the proper treatment, to also answer what is currently there, also in the digital world. And what we would say is that it's a multimodal treatment approach. That first, of course, you have some gynecological appointments where you make sure that you don't have any medical issues or hormonal aspects or for causing pain, etc. But then we would treat it in an efficient way, which is sex therapy, and where I'm also specialized. And with the sex therapy, we would address the distress component regarding sexuality. And because in this sex therapy, we also do talk a lot about, of course, the relationship, but also give a lot about, or talk a lot about education, sexual education. We really thought it's a great idea to translate a lot of the missing education that also causes distress because of false assumptions or stereotypes around sexuality, or even sexual scripts that cause the distress for you. It is actually it could be a great tool to have scalable digital solutions that help, especially in topics when it comes to a lot of shame, because they offer, of course, privacy, accessibility, and flexibility. And when we look at the German landscape, what we do, or what we can say, is that we always also have to think about reimbursement, because in Germany very much it is still the case that a lot of people expect that health-related services interventions are reimbursed by the healthcare system. And when we look at reimbursed options, we currently in the sexual health domains have 2 on the market, one for erectile dysfunction for men, and then we have another one for vaginismus from Hello Better. And they are both offering basically, you can get digital interventions that can be prescribed by a gynecologist if you have the problem, and you can use them for 3 months. And the issue a little bit here is that what we do also know from the representative survey is that we really do have a diagnosis problem in Germany. So when we look at the women, we know the prevalence is huge, as I just said, but at the same time, we do know that in the women that currently fulfill the criteria for having a sexual dysfunction with distress, that less than 20% have received a diagnosis in the healthcare system. So actually it's really difficult also if you need the diagnosis for the prescription to get the treatment even.
And right. So in essence, even though solutions are there, or if they would be there, healthcare providers are not necessarily trained to diagnose this or even know that they can actually prescribe something, right?
It's getting better. It's a learning curve, but this is definitely an issue, especially in the sexual medicine world, and because of the diagnosis issue. And this is also why, of course, we can also think about more the lifestyle or self-pay sector. And there we, of course, have, femtech is booming. We have solutions already that also focus on sexual wellness, have great health services, like not health services, but rather tools and toys, that we would also recommend for using during sex therapy. And we also do have like startups that focus on gynecological health, especially. So there's a lot there, but really solutions that focus on sexual dysfunction with the distress component, having a therapeutic approach, having clinically validation. This is definitely something that is still missing.
Mm-hmm. If we go outside of healthcare for 1 second,
yes.
You mentioned the importance of education and, discussing these topics even in teenagers. What would your advice be to parents in terms of how to address these topics with their children? I think a lot of parents still rely that all the education is going to happen inside school, or don't feel comfortable discussing sexual health with their children. So how much change do you see needs to happen there?
Yeah, this is very important. I think, parents always try to do their best. So I think they're always doing that. But I think in general, data shows, and also as a psychologist, it is always good to talk with kids already in an open, supportive way from a young age on. And if they come with topics or questions, that you talk with them openly about it, and that you inform them also about what sexuality is, what also maybe, what pleasure is. And this is something that we also see from school educations explicitly, that we see for women, it's a lot about how not to get pregnant, how not to get STIs. And for young boys, it's already way more pleasure orientated. It's way more about that. So I think it would be good to have a shift there as well, also for young females, and also to talk about what pleasure is, and that it is about finding out what you want and need as a young being, and that this is something you need to explore, and maybe also help to explain that certain videos in the internet or some erotica, that they are of course interesting to see, but also to be clear that some of that is maybe rather porn fiction than reality of how sexuality is really happening, and that basically sexuality is really communication kind of between two people, and that the two people, or also you on your own, find out what you want by like being present and experience the intimacy and listen to what you need and empower the kids, maybe in that sense. Maybe this would be kind of an advice.
Mm-hmm. I'm glad you mentioned the importance of communication and discussions, and even the role of therapists. Lately, there's a lot of discussions about the use of ChatGPT for mental health due to various reasons, and some people say that generative AI is expanding access to at least some support. Experts warn that ChatGPT is not a certified therapist, so we need to be very, very careful in terms of how much do we trust the advice and the outputs that it gives us. So how do digital interventions to reduce sexual distress look like? What do they offer to be considered medically sound?
Yeah, yeah, very important point. And I mean, this is also what we see. A lot of people that are coming have talked already with ChatGPT about their problem. And of course, it gives you a first insight of what's maybe happening, or maybe some distress reduction, because you can talk with kind of like a first interaction you have if you really don't have the guts to talk with someone like a person friend with. So this is definitely a benefit, I would say. But of course, as in general, also we need literacy how to deal with these AI tools, and also that of course these informations are not really for granted, and that is you need to go then to a healthcare provider basically, and that they reach a certain limit. So of course this is that. And when we now talk about solutions, I mean, what we tried to develop at Charite within our research group is basically that we drawn from this insights of this survey and also a patient-centered approach. We conducted a lot of interviews with women. We looked at women with especially vulnerability for sexual problems, like women with gynecological conditions. And we interviewed them and asked them what they would want in a digital solution, how it should look and feel and all of that. And what they currently also experience as barriers to using a digital application and all of that. And with that approach, within like the support of the Digital Health Accelerator of the Berlin Institute of Health at Charité, we had the chance to really develop a digital solution. And this digital solution is based on evidence-based content that has been shown in meta-analysis to help in improve sexual function and reduce sexual distress. And these contents are, for example, knowledge about anatomy and knowledge about sexual communication. Like I think a few topics you already touched. And we tried to incorporate this, what is evidence-based, plus in a way that we do it in the clinic. And we have a biopsychosocial framework for the treatment. This means that we have modules that focus on the body aspect, the mind aspect, and also the interpersonal level. And this definitely stems also from the perspective that at Charité, where I used to work, and also we now doing, we develop basically this intervention, is just one sexual medicine, specialized sexual medicine university clinic out of 3 in Germany. And with the research group around female sexuality led by Laura Hatzler, she's a gynecologist and sexual medicine expert, we basically, this is the way how we treat patients in this interdisciplinary approach with the team of like gynecology, psychologists, and different other medical disciplines. So we tried really to incorporate this, because this is something that we know from the clinic that worked very well to do and treat women like this.
Mm-hmm. Yeah. So would the digital intervention be combined with actual in-person visits? Does it serve as homework, between visits? What's the relationship between that?
Yeah. Yes, very, very good point, and also very interesting now because we're analyzing the data right now. So how we developed the digital intervention, coming from the idea that we saw the huge need, we saw the shame and stigma still around it, and we wanted to develop something first that women can do by the comfort of their own, by their at their homes, and have it as a starting point and see maybe as a triage product even, and see how much more they need afterwards. Maybe it's already enough for some, and maybe others need more. This is how we thought about it and how we developed it. So what we developed is a self-guided program that consists of these 8 modules that women can do on their own. And in these modules, you have contents that are displayed in a multimodal way. So you have a lot of videos, you have audios, but you also have text. So you can really understand what you basically find interesting and what is like relevant to you. And then you have a lot of exercises also included. And these exercises have a broad variety. So we have exercises for the pelvic floor. We have relaxation exercises. We have body-based like guided masturbation exercises to get more in contact. And it also includes, for example, sensate focus, which is a typical sex therapy exercise. And it was designed to be in a way that women can do it either way they are single currently or they are partnered. So they can decide themselves if they want to include their partner in the process. And then they can do the sessions also basically together. But basically it's self-guided. So they go through the contents by themselves, and they have exercises and also kind of homeworks. But what we do now analyze and also see because what we did is we developed the digital intervention, and we already did a randomized control pilot trial with 60 women, and we're currently analyzing the data. But what we already know also from qualitative interviews is that for some this is enough and they feel much relieved and way better after the intervention. And for some they say, I would want now to consult a session with you and have this as a blended care approach, maybe even to talk about that, because some points or topics I did reach a certain end just working on that on my own.
Yeah. So what's the desired outcomes that you are trying to achieve with the digital intervention, and how do you measure it? Is it all based on patient-reported outcomes, or?
Yeah. So the study that we had conducted was first of all a feasibility study. So first the goals were to understand more about adherence, acceptance, safety of the intervention, and then exploratory see changes in sexual health-related outcomes. And the outcomes that we were looking at were sexual distress with the scale I mentioned in the beginning, the female sexual distress scale. We also looked at sexual function, of course, and improvements there. Sexual self-esteem was also something that we measured, and also validated questionnaires around fear of sexuality, cognitions around sexuality. But we did not only assess sexual health-related aspects, we also looked at overall health status, and there we used the Promise 29, which is like inventory to measure also aspects of quality of life, including depressive symptoms and anxiety, fatigue, and so on. Also, of course, we were assessing pain. Because this is also, of course, relevant. And there are a few more. We have it pre-registered, so it's already online, what we all assessed. But it was a very broad study to also see what this intervention can impact, basically, to learn more about that.
You alluded to a lot of secondary consequences that can come from sexual distress. So let's talk a little bit about that. How do you see that it affects relationships and partnerships? What does research say about that? And we'll then move a little bit more on why. Is this just a medical issue? Is this an issue that should be seen through other lenses as well?
Yeah. So with relationships, it definitely, of course, has an impact. And the thing is, as I said in the beginning, also for like developing a sexual dysfunction, relationship conflicts can be an etiological factor that can be coded to the development of the sexual dysfunction and distress. And this is also what we see when we look at data. There are actually mixed results about if relationships are protective or a risk factor. In one of the studies that we conducted, we actually saw that in women with a chronic health condition, being in a relationship was protective for developing a sexual dysfunction with distress, but in the ones without a chronic health condition, being in a relationship rather was like a risk factor for developing a sexual dysfunction with distress, because or a hypothesis around this might be that that the relationships, of course, can add pressure to engage into sexual activity, and if you have no desire to do so, or if you have pain during sex, of course, you maybe don't want to. And if you're in a relationship, you're more confronted with the negativity of what this does to the relationship. Mm-hmm. And another point maybe I also want to say is that we also do know from studies that if one person in the relationship has a sexual dysfunction, this often also impacts the other person in the relationship, meaning that they could also develop a sexual dysfunction. An example is, for example, that a woman with a pain condition, that the male partner, as a consequence, has like an erectile dysfunction because the male partner doesn't want to hurt the woman, and with the penetration aspect, the pain is maybe the most present, and this is then why both have like this distress. And maybe to summarize that, this is also why it is so important. It's always, like as also in the book you said in the beginning, it's always very individual, and this is also why it needs then also like an individualized approach. Plus, it is important if there's a partnership that this person, of course, is somehow included in the process.
Which opens up a whole new plethora of are people even capable of communicating and discussing these topics and at which age. One thing that we haven't touched upon yet, but I think it's time to move in that direction, is the market and also just the general landscape of supporting the innovation and investments in these solutions. So I wonder, what have you discovered in that sense? It does sound to me that despite, people expecting reimbursement, a lot of these solutions could fall under wellness or just the willingness of individuals to pay out of pockets for apps or even consultations. So what did you discover so far? Generally speaking, we definitely know that, femtech has a lot of potential, but is underfunded, especially with data for the development of solutions.
Definitely. And I would also say, so, I mean, my understanding right now of having developed this digital intervention, and we are now, we were very lucky to have this funding from the Digital Health Accelerator program, which enabled this basically for the research group Laura and myself to develop this digital intervention. And basically what we learned right now, or where we are standing right now, is that we are thinking that to have a successful product in the market, that you have to think both ways and that you have to go two routes, which is the route of having a lifestyle product that is for self-pay, maybe, that is fast and flexible and accessible, also for the women that can afford it. But at the other hand, I think you need, as a startup, you need to think about reimbursement very early on. Either way, it's a selective contract with health insurances or like the DIGA approach. And but of course, going these two ways at the same time, or maybe also a little bit afterwards each other, is of course time intensive. It's also cost intensive, and there you need a lot of funding. And we also all know that right now the funding is a little bit tricky at the moment. Femtech, of course, is booming, but also Of course, it's tricky to also raise money in that domain, and I think this is definitely something that we are now deciding at a point where we're deciding what to do with the digital intervention that we developed. We're currently analyzing it, and we are excited to see where this brings us.
Mm-hmm. Do you by any chance have any data or any insights on the European level in terms of, the interests for fundings? Are there any successful solutions?
This topic, sexual health in women especially, really matters because we do know that the prevalence is huge. Lifetime prevalence of a sexual problem is 70% in women, and when we talk about the sexual distress, it's 1 in 4 women. So the market size is huge, and at the same time right now it's completely underserved, meaning that these women are silently suffering, even though evidence-based treatment and solutions would exist that basically could treat the sexual distress and improve overall quality of life. And we also see that in femtech, there's also a lot of money and that women also are willing to pay for solutions that help them. And sexuality, of course, is a very important part to their overall health and relationship satisfaction and quality of life. And they want to use it as a resource. So I think this is why it's important that we really need to acknowledge this more as a really topic and domain where funding and investment is needed. And I am very lucky to have like a mentor from the Nordics. So I know a little bit about the Nordic space and had the chance also to talk to investors in that field. And what I always hear from basically investors from all over Europe and also the US is that they really understand the problem, that they really like also the idea, and that they also see the market and the potential. But what is always the tricky part is then the business model still in femtech. We right now still need to figure, this comes back to what I said before, out the way of, is it like a self-pay lifestyle solution? Is it a reimbursement solution? And you need to find a roadmap that makes sense. And here you need the right investors that also go with you in that direction of the roadmap you want to go at.
Yeah, or policymakers that are open to just making this a part of healthcare offerings.
Yes.
Is there anything that you hope to see in the field in the upcoming years, based on the research that's happening, based on the trends, based on the fact that we're discussing this a little bit more? Anything?
Yeah, I think what would be really great to see is if all of the things we know from the clinical experience and also from the data, from the evidence-based things, that these solutions that actually can make a change and can make a difference for women, that we bring them to the women, to make them accessible. And I would wish for that we find ways to make this accessible by dedicating funding to these topics that are relevant in the broader aspect of quality of life, health, and I think this would be very important to see, to making this accessible. And what also would be great, we are currently, as I said, we developed this intervention and we're now deciding with what route we're going and what to do. So if someone is listening that also is interested in that kind of journey, I'm also happy if listeners would reach out and to talk more about it and what possibilities there might be.
Awesome. We'll definitely add a good contact in the show notes. I asked you earlier about advice you would have for parents to talk to children. What would your advice be to women that might be listening right now and are experiencing issues that they would like to address?
Yes, absolutely. I would say you're not alone, even though it feels this way, and there's help out there. So it's never too late to go to a gynecologist or a psychotherapist, a sexual medicine clinic or sex therapist and get the help that you deserve. and that is out there, and solutions exist, and you just need to find them. It's a little bit unfortunate that you have to do the work, but if you find them, you will feel better, and yeah, I'm sure you will make your journey to come back to, and I think this is where we started. The goal is always to have pleasurable, safe, and pain-free experience.
Selina, thank you so much for all the insights, and good luck with your future research.
Thank you so much for having me.